All right, welcome back everyone to another one of my ruptured patellar tendon updates. If you've been following this playlist, 2 months ago today, 8 weeks, I was playing a tennis match and I blew out my knee, i.e. ruptured my patellar tendon. So my last video I did was 6 weeks post-surgery or post-op. So a lot's transpired since then, so I wanted to spend a little bit of time today and make a video about the progress that I have made within the past 2 weeks. So here we go with the 2-month post-op ruptured patellar tendon video. On the last video I made, I had not had my brace, my knee brace, unlocked for ambulation, which is synonymous with walking, and that has happened. My flexion, my ability to bend my knee is much, much better. I still do have my areas where I can be much better in, but there are areas where I feel like I'm ahead of the game and other areas where I think I'm behind it. So here we go. Let's see how this leg's doing. All right, so what I'm going to start out with first is I'm going to remove my knee brace, which is now unlocked. If your physician has not advised you to do this, I would not recommend doing so. Mine has in a controlled setting. So what I'm going to do is I'm going to go ahead and undo my knee brace. So here we go. Please pay no mind to my very thin quadricep. That's something myself and my physical therapist are working on. So that's kind of a normal aspect of this injury, is losing muscle mass or having atrophy in the quadricep. So what I'm going to do is I'm going to release the buckles on my brace, remove it. You can see how still small that my quadricep is, but I wanted to show you where I'm at from a flexion standpoint. So right here, where I'm supposed to be right now is right around 100 to 105 degrees of flexion, and I'm there. Physical therapy for me, my last physical therapy was 2 days ago, and we were at 105 that day. As well, I made full rotations on a bicycle, so I was able to actually pedal the bicycle in full rotations all the way around. So you can see that with my brace off, my extensions are good, and then my flexing is really good as well. So I don't know if you can see it from that way, but overall my flexion is doing really well. We're above 90 degrees, so that's a positive. Do it one more time. All right, so one of the things that I just began to get the ability to do once again is climbing stairs. So again, I'm not going to start racing up the stairs, but I'm going to use my right leg and I'm going to get it to that 90 degrees or above flexion, and I'm going to put my weight on that leg and I'm going to proceed to go up the stairs. So this is a big time thing for me, really big. So let's go, come on. So here we go. Here, I'm just making sure I'm balanced and controlled. Here. So this is a really big deal for me. So for the past 8 weeks, going down the stairs, I've had to butt scoot. I'll show you what butt scooting is in case you are not able to do this yet. So this is what I've been doing, is butt scooting. Right? So I've been butt scooting like this for a while, going down, right? So, and before that, going up, I was doing this. Okay? So, now, good. Now I'll come up and then I'll go down one time how I can do it now. Now going down is a whole different ball game. Going down is much more difficult. My physical therapist yesterday, super awesome girl, she does a great job, was telling me that good things go up and bad things go down. So going up, the good leg leads, and going down, the bad leg leads. So here's how I'm able to get down the stairs with her advice. Here we go. Bad leg down. Bad leg down. And you don't want to get ahead of yourself because you can fall. That would not be good. All right. So 8 weeks post-op, I'm going up and down the stairs much better. All right, so a couple of the exercises that I've gotten into now without my knee brace on are things like leg extensions with light weights around my ankle only. Now, I have to be careful with this one because when I do these leg lifts, okay, it's very tight in this area, and if I push it too quickly or I try to do it too fast, I do get a lot of discomfort in the knee area and just above the knee area. So I try to do it controlled up, controlled down, controlled up, controlled down. Another great exercise is called a hip abduction, and that's where we get our injured leg. And you want to do it for both legs, so your other leg is staying in shape with the injured leg, or staying on par, if you know what I mean. So we lift the leg up, control it down. Lift the leg up, control it down. You can lift it up and go forward. You can lift it up and go backwards. Again, I have a chair behind me, but this is kind of the consensus. Up, forward, back. So this is a really good exercise too as well. It's helped me tremendously with the stability of my quad when it gets a little shaky. All right, so another exercise that is absolutely imperative to do is called the heel slide. That's where we slide the heel up and try to flex the leg as much as we can, obviously without being in too much discomfort. So, this would be ideal, but obviously that's not going to happen today. So what I would like to do at 8 weeks out is get to about 100 degrees, and I'm able to get there. It's much easier for me to sit and let my leg, with gravity eliminated, just kind of dangle down. I can get to 105, 110 degrees, no problem. But when I do the heel slide, there's a lot of tension in my quadricep tendon. It feels really tight here, and my hamstring's really weak as well. So it's hard for me to pull this back as far as I would like to. So here we go. So heel slide and down. Heel slide and down. Straight leg lifts or leg raises are something that I do almost without stopping. I continue to do straight leg lifts with the brace off. So the brace allows our leg to lag at the knee joint. I want my leg to be fully extended on my own power. I don't want the brace to be holding the bottom of my leg up. I want to hold the bottom of my leg up. So after the injury happened, just after surgery, if I lifted my leg up, the lower part of my leg would fall to the ground, kind of like this. I couldn't keep it up, but now I'm able to lift, down, lift, down, lift, down, lift, and down. Keeping the bottom of the foot, keeping the toes nice and good posture, and keeping the foot up and not letting the foot lag forward. So the toe up and down. So one of the most important exercises that I have been advised to do by the surgeon or by my physical therapist has been what's called quad sets. This is a relatively easy exercise, but if you do it right and do it long enough, it gets stressful. It gets a little bit painful, not in a bad way, but you can tell that you're doing a lot of work. So what we do is we get a towel, we roll it up, put it under the knee, And the goal here is to push the lower side of our leg to the ground. Obviously we can't because the towel's there. It's serving as resistance. So what I'm going to do is I'm going to press the bottom of my leg into that towel, and I am going to press and hold for 5 seconds. I will do sets of 30 of these, so if you can do the math there, it's time consuming. 30 sets, holding for 5 seconds and releasing, so be patient with this one. So we press, 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, release. Press, 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, and release. So we do that in reps of 30. Again, you're going to be down for a couple of minutes doing that. I know a lot of us get bored with some type of exercises like that, but try not to think about it as boring and laborious. Try to think about it as very important to bring your leg back to life. So if you've been through this injury, one of the most difficult things that you can possibly do is put the shoe on, especially on your injured leg. So I'm going to show you that I've kind of gotten the ability back to do this. So I'll put my left shoe on first. No problemo. And put my right shoe on. So I know that doesn't look like a big deal, but not terribly long ago, I wasn't able to shower on my own. I wasn't able to put my socks and shoes on. I wasn't able to bathe or use the restroom. And now I can do that. More importantly, now I can get off the ground on my own. So I'll show you that. Okay? Boom, let's go, let's get down. Let's get down, come on. So throughout my entire life, one of the things I always neglected was squats. I have long legs, I'm over 6 feet tall. So my legs have always been problematic when doing squats. So I was cleared to do squats, what they call half squats or quarter squats. So I was cleared to do that. So I'm going to show you how I do that. We use the wall for support. So I back up against the wall. And when I first started doing this, I used to lean into one direction. I used to kind of lean off to the side. My physical therapist out there can tell you that. No matter what, I would always lean over because of the leg. So now I'm able to kind of balance out, get set against the wall, and go. 1, 2, 3, 4. So I can do pretty good at this. So I want to do 30 gee whiz. I want to do 30 reps and 3 sets. So a total of 90 squats. Okay? So it's nice to be able to do this again. Let's get down. All right, so one of the biggest problems I've had getting back on my feet has been walking. I walked like this for so long. I would kind of drag my foot over and drag it and drag it. So I'm slowly but surely learning how to walk again. So we walk. So getting better with the walking too. All right, so in ending, I guess the most important question is what are my biggest obstacles? Where am I in terms of inside my own head? Where am I not doing so well? So I guess I'll start from the top. Number one, first of all, I broke my wrist at the same time I ruptured my patellar tendon. And as a tennis player, I went out on the tennis court today and I was trying to hit some balls. And it's still very painful once the ball strikes my strings. It's very painful in the wrist for my wrist to absorb that impact. But neither here nor there, this video is about my leg. So when I have the brace unlocked and taken off completely, the stability of my quadricep is not very good at all. So I know that my quadricep and my hamstring are still both very, very weak. So I can walk okay without the brace on, but it's very, 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 very I guess you could say, scary in a way, because it's every step that I take, I feel like my leg might hyperextend, or it might buckle to the left or buckle to the right. So even though I was just walking and you're watching that, it was very controlled, especially when going up the stairs, very focused walking. So one of my biggest issues I know is going to be strengthening the quadricep and strengthening the hamstring. It's crazy because 9 days went by from injury to surgery date, and within 9 days, I lost that much muscle in my right leg, obviously going through the convalescence of post-surgery and being laid up for a while and so forth. But over that 9-day period of injury to surgery, I literally watched my quadricep disintegrate. Number two, during this injury, I've lost about 15, maybe 18 pounds. Usually I'm around 160, 158, 155, give or take. I was at physical therapy the other day, and I was about 150, 149, somewhere in there. So I definitely want to put weight back on. So that's another a gray area for me. So what I will continue to do is do these videos and update them as changes transpire. So from week 6, just to recap, from week 6 to week 8, I've had the brace unlocked. I have been able to learn how to walk again. Some other exercises that I haven't done on this video that I'm cleared to do are leg extensions on a machine. In other words, like in a gym, you put the leg in and you lift with weight, and very lightweight in this sense. 2 hamstring curls. You're laying down and you're lifting the back of your leg up, so you're working your hamstrings. So I'm cleared to do those as well, but at this point only with my physical therapist. She's a tough customer. She pushes me pretty hard, but I will, once I'm cleared, carry that on my own cognizance at a gym when I'm allowed to do so. So I hope you enjoyed the 8-week post-op video. It wasn't very well prepared, sorry about that. I didn't want to let this day go by without at least touching base. Hopefully everyone is well. Subscribe to my channel, by the way. Carl and I will return to our 5K tennis analysis starting January the 1st, where we will do our inaugural 2020 show. So if you want to stay in touch with the 2020 Men's and Women's Pro Tour and the world of tennis, then be ready for that. Anyway, I hope I haven't forgotten anything or anyone, but that's it. So 8 weeks post-op, things are looking up, but I do know, and in all honesty, that there's a long way to go. So, also today, when I was out on the tennis court, I took my brace off just for a second and tried to just hold like a tennis ball or a racket in my hand and kind of just move at the waist a little bit. And that felt pretty good, but again, I have been advised that there will be no sport for at least another 6 months. So we'll see how that goes. Stay in touch. Much love to everyone, and thanks for watching. See ya.